10 years ago, as an MSF doctor in a Congo-Brazzaville sleeping sickness project, I faced the cruel reality of treating patients with what was then the only treatment for the deadly and horrific disease, sleeping sickness. Milastopol, an arsenic derivative, killed 1 in 20 patients, and it was all we had. It was the only drug. As doctors, we were outraged by the sense of each medical act aimed at treating but potentially killing. After years of frustration among MSF field teams unable to treat their patients because of the dire lack of appropriate treatments for life-threatening diseases affecting neglected populations, the MSF Access campaign decided to take action. The campaign carefully examined the gaps in the neglected diseases R&D pipeline, and we analyzed the landscape. The results were astonishing. There was what we call, and still do today, a fatal imbalance. Drug development was not addressing the needs of the poorest population. This is why MSF decided to commit a portion of its 1999 Nobel Peace Prize funds to set up a new model for research and development. This was the creation of DNDi. The organization literally started out in an MSF garage. Other founding partners came on board, notably research institutions in endemic countries like the Oswaldo Cruz Foundation, the Indian Council of Medical Research, the Kenya Medical Research Institute, the Ministry of Health Malaysia, but also Institut Pasteur of France and WHO TDR as a permanent observer. Each of these partners had a very particular role to play as DNDi gatekeepers by ensuring DNDi stuck to its roots, keeping patients at the center of everything it does. In 10 years' time, DNDi quickly pursued some very urgent short-term goals by combining, repurposing, or reformulating existing drugs to offer treatments that were shorter, less toxic, and cheaper than what was being used, but also to bring treatments that where none really existed. 6 treatments in 10 years to treat malaria, leishmaniasis, Chagas disease, and sleeping sickness. We have to remember that these diseases occur in extremely remote areas, and DNDi managed to partner with public and private actors to conduct top-quality clinical trials in harsh conditions. But DNDi also strengthened local capacity at the same time and has built both South-South and North-South collaborations. Today, DNDi faces the challenge of bringing the longer-term breakthrough therapies through the pipeline, and this is not just for one disease, but for 6 diseases. The challenge is daunting, and we hope that the next 10 years of DNDi will see the long-term strategy bear its fruits. MSF is waiting for these therapies, and we support DNDi in its success of the past decade and in facing challenges of the future.